Stay tuned because Good Sports is coming next.
Good Sports was recorded on Wednesday, January 25th. Welcome to Good Sports, the Kansas City Sports and Fitness Show. I am Steve Fish. I'm the publisher of Kansas City Sports and Fitness Magazine. Today we're here at Core Strategies Physical Therapy, Sports Performance, and Medical Fitness. The physical therapists at Core don't just treat symptoms, they treat the whole person. Treatment plans are customized specifically for each patient and their unique needs. At Core, they educate you about your issue. They create and implement a program to help you and empower you to prevent future occurrences. Core Strategies Physical Therapy is located at 10400 West 103rd Street, just on the east side of 69 Highway. For more information or to set up an appointment, and no doctor referral is needed to set up an appointment, call Core at 913-322-4000 or visit their website, coreptkc.com. Before we get started with the show, I want to tell everyone that our current issue of Kansas City Sports and Fitness can be picked up at over 700 locations in KC, and it's absolutely free. Also this month, KC Sports continues to celebrate our 19th straight year as the Sports Illustrated of Kansas City. Now, in our hockey report presented by the KCI Center, we celebrate Hockey Week across America and the Try Hockey for Free programs in February at the KCI Center. And in Chloe's Corner, the Ren Insurance Tennis Report, we introduce you to the founder of EssentialTennis.com, Ian Westerman. Now joining us from Core Strategies Physical Therapy, Sports Performance, and Medical Fitness is Jennifer Westerberg. She is a physical therapist and one of the owners of Core Strategies, which is located just east of 69 Highway on 103rd Street. Jennifer, welcome to the show. Thank you for hosting us today. I appreciate it very much.
Thanks so much for being here.
So the staff at Core contributes an article each month to Kansas City Sports and Fitness, and you can find them online at kcsportspaper.com. You can pick them up at over 700 locations. For this month's issue, and we're taping this in January, you obviously talk about New Year's resolutions, right, and the things about New Year's resolutions that can cause us to potentially have trouble, sure, because we all are so gung-ho, right, about what it is that we want to do and things like that. So, the first question that I have for you is an acceptable norm for pain. What we can all get when we are so gung-ho, me included, sometimes, will cause pain. What is an acceptable level of pain? What's going on? And when do we turn it from, okay, I'm fine, I just need to heal, to, sure, okay, I better go talk to somebody?
Right. Yeah, that's a really great question. As you start to exercise, the muscles start to break down. So when we're doing strengthening exercises per se, we're breaking down those muscle tissues so that they can start to build up and get stronger. With that breakdown of the tissue, you will get some soreness, and that muscle soreness tends to come on a little bit delayed. So it's called delayed onset muscle soreness, and that might happen 24 to 48 hours afterwards. And that's typical and normal, but you also don't want to feel like you can't move. But a lot of times we've done that, especially when we're younger and we're trying to get stronger again because we've been off season for a while. You're gonna have those few days where, oh gosh, it's so hard to stand up from the chair now and sit back down. But and so that's normal to a degree. But you want to watch how much you push that. The other thing is watching if you're having pain. If you're having specific pain when you're doing a specific movement and an exercise, that's where you need to really be cautious. Watching the knees, watching the back. If you're getting that ouch kind of grabbing pain, that's not good. That's where you really need to watch it. If you're getting fatigue in the muscles, that's okay. But when it gets that ouch kind of pain, that's when I need to probably get this checked out or stop. See if you can modify the exercise you're doing or then get it looked at. Yeah,
because I started this year and started doing 10 minutes just on a plain old recumbent bike like what you have here. 10 minutes was too much.
Yeah.
There were old pains, old things that came back up, and so I just kind of curbed it back. I took a couple days off and curbed it back and do 5 minutes or
exactly,
whatever.
Yeah, we got to work it back up into that.
Yeah, we're not the he-men and he-women that we used to be when we were 18, 17 years old or whatever, and we have to be cautious of all of that. So that pain that we feel for a couple of days, there's actually, I noticed that there's a difference between the good pain and the bad pain.
Right.
Where you go, okay, this is good. What's going on with the good pain? What, in that 24 to 48 hours, you've worked the muscles.
Kind of like we mentioned a moment ago, so that those muscles start to break down. So you get that breakdown and the lactic acid goes into the body, and that's what you're feeling is that pain, that soreness that's there. And that's all normal. That's a normal process whenever we're breaking down the tissue. And so that's nothing to be afraid of or scared of. That just happens happens normally. But within, 2 days, 3 days, that should go away completely. If it's not going away, that's when you need to look at what was I doing, what might have caused that. Did I do too much on the recumbent bike, like you were mentioning? And then how can I just back it down? If I start with 5 minutes as opposed to the 10 minutes, am I okay? Okay, now that's safe. Now every week, and something like walking or biking, running, any of those kind of things, the experts say only bump up about 10% each week. So some people go, I did 5 minutes this week, I can do 15 minutes next week. More than likely that's going to get you into trouble. So starting to ramp up slowly is better than to just go all gung-ho like you mentioned.
Yeah, so, and if you have that pain that maybe you're pushing through and you shouldn't be pushing through, you might wind up compensating, and that causes, this stair-step effect that can send you even spiraling into worse situations.
Right. Yep, that's so true. Yeah, like you mentioned, you brought up these old injuries that you have.
Yeah.
So if something's hurting, say it's your knee that's hurting whenever you're riding the bike, and you really want to ride the bike. Well, if you can't bend that knee as much as you need to get your leg around on the bike, are you going to twist or bend over? Now it's bothering your hip, maybe your back. So you might get other compensations that you're doing for that, and that can lead to just a domino of issues down the pike. Today it might not be a problem because you can do it and keep moving the knee like you feel like you need to, but eventually do you get up and go, gosh, I don't know why my back's hurting. I'm just sitting there on the bike. It shouldn't bother me.
Yeah,
but
really.
You might be compensating for something else. You don't even realize it.
Exactly. And my workout is very, very simple. So other people that have joined the gym are going to, do the elliptical and do the treadmill and do the bike and all that stuff.
But it's the same kind of problems that they can have too. Yeah, exactly.
Yeah. So the solution for that is to grab hold of that pain and the situation as soon as you can.
Of course, yeah. Get it addressed sooner rather than later. And that's one of the things that we do here with some of our wellness stuff. And from a PT standpoint, if you're having specific pain and issue that we can address from that standpoint, we can do that. But from the wellness side, we've also seen the need for our patients and clients that really need to have the whole body addressed and looked at to see, is there something that might be going on? Maybe before they start sports. Now being January, we're getting some of the golfers in that it's too cold and wet and yucky to want to play outside, but they want to start conditioning their body now so that they're ready come March and April to start playing golf. If you've been sitting around all winter and not doing anything and the back's not very flexible, do we need to look at the back, or is it actually the hip that's causing the problem? You're not following through enough with your swing and you're not getting that ball down the fairway as far as you thought you could last season. How can we help with that? So there's different things that we need to make sure that we're looking at the whole body and the whole picture to make sure that we're addressing all those.
Right. And I mentioned it when we first started. People can contact you guys and they don't have to have a referral from a doctor. In the old days, and it was, 8 or 9 years ago, you did, but that's how we kind of have it in our heads that I need to go to the doctor first. But you don't. So that golfer can come in and start this with a tune-up and workout, and even a kid and things like that coming back, and by addressing that issue early on, it can save you time and money as well.
Oh, of course, yeah. Studies have shown that specifically they've done a lot of studies with low back pain and showing that the earlier intervention, the better you do and the more money you save. Because, if you only need to go to PT maybe a few times or see your doctor a couple times, that's going to be much more worth your time and energy doing it now as opposed to waiting. And now we've got those patients like we've been seeing, chronic back pain. And interestingly enough, at the end of this last year, we saw a lot of patients that, I've met my deductible for the end of the year and it's December 15th. Can you get me in and fix my back pain that I've had for 10 years? Well, we can get started on that process, but probably not. We're not going to fix it in 2 weeks because it's been going on for so long. Yeah. So the quicker you get that addressed, but somebody that hurt their back maybe December 1st, slip on the ice and maybe not fall, but just enough to just kind of
catch yourself.
Jar their body, come in for a couple weeks. Now you're doing great. And go back to your activities and not have any pain. So
when you see somebody like that, and I know it's going to vary for each individual, how many treatments, how long, how many times a week do you see them in order to, and everybody's different again. Sure. But, what's the average
typical
for something like that?
Typically 1 to 2 times a week is average, especially for some aches and pains like that. And if it's something that's pretty acute, maybe 2 to 3 weeks, and we can get people back out to doing the things they need to do. And then maybe we see them maybe once a month after that for a couple more times, just to make sure they're still doing well. Now, if it's a chronic condition, we might see them 2 times a week for 2 to 3 months to really kind of get things back under control. Because now, like we talked about the compensations, there are a lot more moving parts that we have to address and look at. And so that's one of those things we have to look at. And it takes longer. So if we're seeing somebody 12 visits, that's going to cost them more money than if they only had to come in 4 or 5 visits.
Right. Yeah, because, I mean, you're dealing with behavior at that point. You're not just dealing with temporary, couple of weeks of pain and straightening out. You're dealing with, you've been walking wrong,
exactly.
for quite a while, and that takes a little while.
Yep, it sure does.
That takes, like you said, the 10-year back issue that you want, can you get a quick fix for that? That's all we want is a quick fix.
I know it. If there was a pill for that, we'd all have $1 million. Huh?
Yeah, we'll talk about those pills in our next segment. That aren't for that purpose.
Right.
So give us the information on how people can reach you and how they can set up an appointment here at CORE. And again, no referral is needed for that.
Which is fantastic. Since 2013, it's great. So they can call us, 913-322-4000. They can check us out on the web at coreptkc.com, and we're also on Facebook as well.
That's excellent. Your hours are, you're here Monday through Friday, correct?
Yep. We do have some classes that we offer on the weekends, but for the physical therapy stuff alone, we're just here Monday through Friday, 7 a.m. to 6 p.m. So we've got before work and after work times, and we can get people in most any time that they need.
That's terrific. That's wonderful. Well, when we come back, we're going to talk about some of the solutions that, some of the myths that people have with pain, and some of the solutions that are good for you, and then some of the solutions that a lot of people do that are necessarily not good for you, and the solutions to fix that. We're going to take a quick break. You're watching or listening to Good Sports, the KC Sports and Fitness Magazine show. We're coming to you from Core Strategies, Physical Therapy, Sports Performance, and Medical Fitness. They're located at 10400 West 103rd, just east of 69 Highway in Overland Park. I am Steve Fish. We'll be right back.
Come on out to the Kansas City Ice Center and skate on the outdoor pavilion or the indoor ice rink. And sign up now for Learn to Skate and Learn to Play hockey classes at the Kansas City Ice Center. The KC Ice Center is located 2 miles west of 435 on Johnson Drive. For more information on public skating times, to register for classes, or schedule an upcoming party or group event, visit kcicecenter.com or call 913-441-3033. That's 913-441-3033. These days, we're all so busy and many of us ignore our health and let stress turn into chronic pain. Dr. Lynn McIntosh of Kansas City Chiropractic can provide you with the proper care to relieve pain and stress, improve your health, and get more out of life. And right now, new patients can get their initial consultation free. Mention KC Sports when you make your first appointment. For more information on Dr. McIntosh and Kansas City Chiropractic, call 816-753-4600 or visit kansascitychiropractic.com. Experience a touch of the Ozarks at Winterstone Golf Course in Independence. And right now, take advantage of off-season rates, $37 on weekdays and $43 on weekends, including cart. For tee times, visit winterstonegolf.com or call 816-257-5755. Learn the basics or refine your game at the Coaches Open House held each month at Mission Bowl in Olathe. To learn more, visit missionbowl.com or call 913-782-0279. The next Coaches Open House is March 27th. So sign up today. People today use hundreds of sources to find local information online. Have you Googled yourself lately? Bad online comments can irreparably damage you and your business. For a free online strategy review, contact Market Leverage at 816-600-0564. That's 816-600-0564. Looking to buy or sell real estate? Contact Bill Halberstadt from RE/MAX at 816-903-1519. That's 816-903-1519. Teamwork Sports provides volunteer coaches with back office team management, uniforms and equipment choices, and indoor practice fields so coaches can do what they do best, coach. Visit their website, teamworksportskc.com, for more information on how Teamwork Sports can provide equipment, services, and practice facilities to your team. Teamwork Sports caters to baseball, softball, soccer, and lacrosse teams. Visit their practice facility at 310 West 80th Street, just off Warnell, or go online to teamworksportskc.com. Be a part of revitalizing golf by purchasing your copy of the Golf Hospitality Association Playbook for just $20. The playbook is for golf courses, beginning golfers, marshals, and course staff. For more information on the playbook and membership perks, visit golfhospitalityassociation.org or call 816-398-4110. Look for special offers at Papa's Coffee Express inside this month's KC Sports Magazine. Visit them at 124 South Forest and Liberty or call 816-415-0652. Whatever your sport, maximize your performance at Core Strategies Physical Therapy, Sports Performance, and Medical Fitness Center in Overland Park. The team at Core specializes in rehab and performance training for all ages and activity levels. To learn more about Core's sports-specific programs, visit coreptkc.com or call 913-322-4000.
Welcome back to Good Sports, the Kansas City Sports and Fitness Show, the show that complements Kansas City Sports and Fitness Magazine. I am Steve Fish. Today we're here at Core Strategies Physical Therapy, Sports Performance, and Medical Fitness. The physical therapists at Core don't just treat symptoms, they treat the whole person. Treatment plans are customized specifically for each patient and their unique needs. At Core, they educate you about your issue, create and implement a program to help you, and empower you to prevent future occurrences. Core Strategies Physical Therapy is located at 10400 West 103rd Street, just on the east side of 69 Highway. For more information or to set up an appointment, and no doctor referral is needed to set up an appointment, call Core at 913-322-4000 or visit their website, coreptkc.com. Now, in our current issue of KC Sports and Fitness, check out our Heartland Soccer Report presented by Market Leverage. This month, we write about the stories of the Global Football Club that's based here in KC. And in this issue, we honor high school top performers from Olathe South, North Kansas City, and Maryville High Schools. And coming up, on February 11th, we'll be at Teamwork Sports Baseball, Softball, and Soccer Facility located at 310 West 80th on the east side of Warnell. On February 18th, we'll be at the Healthcare Resort of Kansas City located at 8900 Parallel Parkway in Kansas City, Kansas. And on February 19th, we'll be at the KCI Center, which is located 2 miles west of 435 on Johnson Drive. So we are here in segment 2 of Good Sports, and we're at Core Strategies Physical Therapy, Sports Performance, and Medical Fitness, and we're talking with Jennifer Westerberg. She is one of the two owners. The other one is Daniil Debrecht of Core Strategies, and they're located here at 69 Highway, just on the east side of 69 Highway on 103rd Street. Again, Jen, thanks for hosting us today. Thanks for filling us in on on the information that we talked a little earlier about
Sure.
about New Year's resolutions. We're going to continue that discussion here in just a second. But first, can you give us a quick rundown on Core and the type of people that you treat and the
Sure.
type of services that you provide? We touched on some of those, but give us a little bit more.
Yeah. At Core, we treat all ages, young to old, and young at heart as well. A lot of patients that we've seen come from varied backgrounds, the sports and athletic backgrounds,
Right.
high school students that get injured. We'll talk a little bit about some of the organizations that we work with specifically, but some of those kids will come in, whether it's junior high school kind of age, hurt their hamstring running out on the track this weekend. And so that age. And then we also, deal with our elderly population as well. Kind of midday, we're working with the elderly population, neck and back pain. And then we have kind of our middle-aged folks that have young kids at home, and they're running around with the kids and the weekend warriors, and injured their back trying to do some snowshoeing or something. We don't have too much snow right now, but I have actually somebody that likes to run through the woods and find different obstacles throughout the woods, and he wants to get back to doing that kind of thing. And so all kinds of different patients that we see here. And then we also have the wellness stuff as well. So when our patients are through with PT, or even as they're transitioning through the PT as they get better, they start to do some of our wellness services. So we have private training, so one-on-one training. We do some small group training. Then we also have classes. So behind me is some of the Pilates equipment that we use for some of our classes. Then we also just do classes out here in the gym where we're using some free weights, some medicine balls, different things like that. Work on balance with some of our elderly folks as well. So we've got a variety of different classes that we offer here.
And one of the things, you've added a couple of new things as well. What are some of those things in general that are new to Core?
Sure, yeah. So this year specifically, and especially this time of year, we're working a lot with the golfers.
Yeah.
So working with the golf swing and getting them back into, golf-ready body so that they can get back out. And then the other thing we're doing with some of the people that aren't able to run outside because of the weather and the coolness and everything is working on some of their technique and their form. So we've got a treadmill here, and we can do running analysis and kind of check those things out as well. And then some new classes that we're adding. And so people are feel free to check out our website at coreptkc.com for the new classes that we're adding this year. So.
And you handle the social media as well. What? How can people find you on Facebook and Twitter? Or
Yeah, I do a little bit with Twitter. I'm getting better at that. And on Twitter, we're at WeFixMovement, WeFixMovement, and then Core Strategies Physical Therapy on the Facebook is where you find us there.
And you can go to coreptkc.com, and right up at the top of it, there's a link to click.
There
but
is.
Then
Exactly.
And I think you can even follow it straight from there.
Yeah, you can.
But you guys share, not only do you share information through KC Sports and Fitness, but through your Facebook page and things like that, you'll share information for those golfers or those runners or just somebody that's injured or whatever.
Exactly. And we try to do some timely stuff too. So based on the season that we're in, what we're seeing that time of year as well. So
and that's awesome. And I love retweeting, or not reposting your Facebook stuff. I'll show you a tip for Twitter as well. Not that I'm an expert, but so your partner here is one of the other owners, Danielle Debrick, who's also a physical therapist. In our December issue, she wrote about pain myths, and these are very common things that we all say immediately pop to the top of our head, but they may not be the answer to the situation, or there may be something deeper and more of an issue to that. So there's like 4 or 5 of them that she identified. I'll just list them off here and let you talk about them.
Okay.
The first myth is my pain went away on its own. Well, that's great. We kind of touched on that in the last segment, but sometimes there's more to it than that, just boom, it's gone, and I can continue what I'm doing.
Yeah, and sometimes even with our patients here, if they've had pain for a little while and after a couple of weeks they're like, oh my gosh, my pain's gone, I don't need to come back.
Right.
Well, normally getting rid of the pain is not the final job. We've got to get rid of the compensation factors like we were talking about before. There's usually things in the background that are going on, or beliefs that, I can't move, I shouldn't do anything because it might hurt me again. So how do we get them back onto, the golf course or back walking with their kids, those kind of things. So there's a lot more at stake than just, I don't have any pain anymore, so I must be fine. Because a lot of times it's just lingering in the background, and you do one thing the wrong way and it might come back. So making sure that that's really addressed and looking at the whole system is really important. I think that's one thing that we do a great job of here, is looking at the whole body. Just because the knee is the problem today doesn't mean that there's not something going on at the hip or the back. That might have been the original issue, and now the knee is the one that's barking at you now.
So myth number 2 is I don't have time for physical therapy, or I can't afford it. We kind of touched on some of that. The sooner you get in, the less it's going to cost you down the road.
Exactly.
But there are stats that show that you need to spend the time for it, that it's going to help you moving forward. Yeah,
it pays off in the long run. And just like they talk about health and fitness, you don't have time not to do it. Getting your annual physical, you don't have time not to do it. At what point is your life and your health going to suffer for not taking care of those little things now? The little bit of time that you put in now saves you a lot more time and money on the back end.
Yeah, and it's less invasive than maybe surgery that you might need down the road.
Or injections
or drugs. Or drugs and things like that. So myth number 3 is I think I need x-rays or an MRI. But that's not necessarily the case. I mean, we all think, oh boy, I've really rolled my ankle, it's swollen and all that stuff. I think I need to see if I've, really injured it. But that's not necessarily the case. It doesn't show the things that
it's not always going to show things. Yeah, exactly.
And break,
yeah, exactly. In some cases it will, but not all the time. And I think that we're also we want to know things. We want facts. We want figures, and I think that helps.
Alternative facts.
Maybe that too. But I think looking at MRIs or X-rays, they feel like I'm going to get the answer that I need. I'm going to find out exactly what's going on, and that's not always the case. And especially with a lot of our chronic patients that we're seeing, X-rays or MRIs aren't going to show anything. And in their mind, they think that that's the end-all, be-all. And if I understand that, then I feel better. And I think that's why we try to really take the time to explain to patients what's going on with their body and why they might not see something on an MRI or X-ray that's going to be problematic or the cause of their pain, but we can help explain what might be going on with them and give them the understanding, the appreciation of that. I think that makes them feel a lot better.
Yeah, and one of the things from our past discussion with this is a statement was made: pain can't be seen with imaging tests.
True.
Because you can have pain and the imaging might might not show anything, or you
Right.
could have imaging that maybe shows something, but you may, I know with back issues, the images can show nothing, but you can still have pain.
Right.
And then there's that scare aspect of it is, oh my God, I've got a bulging disc.
Right.
Well, we all have bulging discs.
Yeah,
sorta.
they've done research to show, they've shown symptomatic and asymptomatic people with back pain. They've done MRIs of their mid-back, and I can't remember exactly the statistics, but a good number of them have disc bulges and had absolutely no pain. So, is there a reason to kind of open up that can of worm if you don't need to? Maybe not. And then you have to think about radiation too. You're getting radiated when you do some of those tests, and is that worth the risk? If it's not something that needs to be imaged right now.
Right. And it may lead to a surgical solution that, you really should come to your physical therapist and talk to them before you take things to that level.
Well, it's always nice to go the most conservative route first.
Right.
And even if you do have to have surgery, at least, if you're doing knee surgery, get the muscles around that leg as strong as possible so it's easier to come back on the back end. And sometimes those kind of things are warranted. But, if you're trying it first and now you're feeling better, then maybe you can hold off and not do surgery ever, or at least for a while.
Right.
So.
And when you work with people, if you see that that's warranted, surgery is warranted, you work with the doctors on that, but you also work with the doctors with patients after surgery to get you back and get you going as well.
Yep.
Myth number 4 is, I just need a pain pill. That's an easy one. Is just popping that pill. And, we had an article, an additional article that we did that I think was in our November issue. It was on opioids and the issues with opioids. Well, that's, that answers this, but pain pills just mask problems.
Right. And they don't actually fix anything. So they just mask it so you don't feel it. And in fact, the opioids themselves actually just make you feel better. So they don't even actually take away the pain, but you go into an altered state and you don't even actually notice that the thing's bothering you, which can be problematic too. Now, again, sometimes they are warranted, so I'm not saying nobody should have them, but we need to watch and make sure that are we giving them to the right kind of person, or getting them off them as quickly as possible too. And then, if you're taking an opioid and I feel no pain in my knee, but yet I'm going to go out and run 10 miles, does that make sense? Then again, let's strengthen the muscles or look and see what's weak and address those as well. So that can lead down a slippery slope, and that's not always the best thing. So. And
it becomes addictive, and that's not
Very
necessarily a good thing. And we've all seen reports on that, and I know that the medical world is trying to change that now.
Yeah, it's very much a hot topic right now for physicians and insurance companies and PTs as well, because we feel like we can address it with other things. I mean, we've got all kinds of different things that don't include medication that can help patients with their pain. So.
Right. So people can find out more about these things by contacting you. Again, give us the information on where people can contact you, Jennifer Westerberg, here at CORE.
Yeah, our phone number here is 913-322-4000. You can also go to our website, coreptkc.com. And as Steve alluded to, from our website, you can also go to different links for Facebook and Twitter and those sorts of things and find out all kinds of information about us.
So a golfer that's out there can contact you that way.
Yep.
What are some of the other sports performance programs that you offer as well? You do running is a big one.
Right.
What are some of the other ones that you do so that people that are, maybe just want to tune up can contact you?
So any of the kind of, if you think about the throwing or rotational sports, so golf, baseball, tennis, all those kind of things, they have very similar things in common that we need to look at and address. And so we work with all those kind of people. Then we've worked with all kinds of different athletes, swimmers, and then just the recreational athletes, whether it's, somebody that wants to go and play golf on the weekends. And then I have, people that do volleyball, whether it's, they play for an actual team or they do intramurals as well. So there's a lot of things that we can do to help, and we're here to help.
That's great. That's wonderful. Well, I want to thank you again for hosting us. That will do it for today's show. Thanks to Core Strategies Physical Therapy, Sports Performance, and Medical Fitness for hosting us today. And Jennifer Westerberg, thank you so much for joining us today. Be sure to join me, Steve Fish, again next week at the same time for Good Sports, the Kansas City Sports and Fitness Show. And check out some of our other shows on YouTube. Search for the Good Sports Casey channel. So until next week, be sure to read all about sports, health, and exercise in Kansas City Sports and Fitness Magazine. You'll find it online at kcsportspaper.com and all over Kansas City. So pick one up today.
Would you like to have us tape an episode of Good Sports at your business location? Call us today at 913-764-2050. Elite Gymnastics and Aquatics has been offering recreational and competitive gymnastics for over 40 years. From preschool gymnasts and swimmers to advanced gymnastic competitors, Elite Gymnastics and Aquatics offers a tradition of excellence. For information on classes and activities, visit EliteGymnasticsSwim.com or call Elite Gymnastics and Aquatics at 913-469-5554. And right now, save 50% off registration when you mention KC Sports and Fitness.
Real people, real deals, real estate. Grace Properties and Development buys houses. Call GP&D today and ask for Matt at 844-GPD-PAYS.
For 120 years, Wren Insurance Agency has covered Kansas and Missouri families with reliable, affordable protection. Auto, home, boat, life, flood, or renter's insurance. Wren Insurance has been covering local families since 1896. To learn how Wren Insurance can protect you and in the process help others in the community, visit their website, wreninsurance.com. That's WRENN insurance.com. Or call today at 816-398-4111. Thanks for tuning in to Good Sports. Watch more episodes on the Good Sports KC YouTube channel.